Welcome to Diabetic Foot Files, the podcast where we dive deep into the world of diabetic foot health, from the everyday challenges to the rare and life-threatening conditions that can take people by surprise. I'm Gabby, call me Dr. G or Dr. Gabrielle Hutchinson-Donaldson, and I'm a podiatrist as well as wound care specialist. And today we're discussing a shocking and rare case of spontaneous gas gangrene in a diabetic patient. This is not your typical foot ulcer story. This is a case where a simple red bump turned into a life-threatening emergency in just a few days. So stay tuned because this one is wild. Before we dive in, I want to make a disclaimer. The purpose of this podcast is to educate both the general public and the healthcare providers about diabetic foot health. Our goal is to raise awareness and improve prevention and ultimately reduce the rates of amputation and life-threatening complications. This podcast is not meant to scare anyone with diabetes, but to empower you with the knowledge to take control of your health. Early detection and proper care can prevent severe outcomes, and by sharing these real cases, I hope to save some lives, not create fear. So always consult with your doctor and healthcare provider regarding any concerns about your foot health. So let's start. Imagine waking up one morning with a small red bump on your foot. Nothing painful, nothing serious. You don't remember injuring yourself, which I hear often from patients, and you think it'll go away. And then within days, your foot begins to swell and the pain becomes unbearable. Keep note of the pain becomes unbearable. And the infection spreads so fast that you find yourself in a hospital facing a life-threatening condition you never saw coming. This is what exactly happened to a man who had diabetes. He's 59 years old. So let's start with a patient overview. A 59-year-old diabetic male, no recollection of foot trauma, started with a small, non-painful red bump on his left foot. The progression. So day 1, small bump on the foot, no pain. Day 2, swelling begins, mild discomfort. Day 3, severe pain shooting up the leg. Please take note, when you hear a diabetic saying that they have a lot of pain, especially when they have some type of wound, that's very concerning because a lot of times diabetes affects the nerves and these people have something called neuropathy. So they experience a lot of numbness and they can't feel that well. So when they start feeling, my red flags start going up and I'm like, yeah, this is very serious. And so keep that in mind always. And so day 4, rapid foot swelling, pain reaches to the lower back. That's even more concerning. I'm like, yeah, let's go take you to the ER right now. What's more terrifying than that, though? This patient had no fever, no chills, none of the usual signs of severe infection. That's why you hear your doctor always ask you any fever, chills, or nausea. Those are things that prelude or show symptoms of a systemic infection, okay? This patient thought it was just a swollen foot, but he couldn't bear the pain anymore. So what exactly happened here? The patient, bacterial infection that produces gas within the tissue. Typically, it's caused by a bacteria called Clostridium perfringens. I always get tongue-tied when I say that. And this is a bacteria that's found within a normal environment, okay? In diabetics who have poor circulation and weakened immune system, it creates a perfect storm for infection. So why are diabetics at high risk? Nerve damage, okay? Can feel small little injuries. That's what I was explaining earlier. Another reason why diabetics have higher risk is because of poor circulation. What happens with diabetics, they have something called atherosclerosis, Markenberg's sign that happens in their arteries, affects the circulation in the legs. And then a weakened immune system, which is usually correlates with hyperglycemia, which is a really high blood sugar. It really does weaken your immune system. So always keep that in mind. When the doctor says, oh, please lower your sugar, I don't really agree with that. Like just saying lower your sugar, but you have to monitor the hemoglobin A1C and daily blood sugar monitoring helps a lot. But when you have a weakened immune system, you can't fight off infection that well, okay? The most shocking part, in this case, the bacteria didn't even need an open wound. The bacteria most likely entered through microscopic cracks in the skin. So that's another thing you need to keep in mind, okay? So that's why, having dry skin is actually one of the complications of diabetes on an autonomic system. So you have excessively dry skin. You see people have what they call heel fissures, the nice little deep cracks, and then the bacteria can penetrate through that, okay? So just keep that in mind if you see somebody, especially a diabetic with severe dry skin. That's why they have made diabetic foot lotions. But you're not supposed to be excessively moisturized as well, because that can cause something called maceration, which is that excessively white, fragile skin that happens. And we always say don't put it in between your toes, okay? Because your toes hold, in between your toes, the sulcus area, that holds a lot of moisture, okay? Okay. So now let's talk about how the doctors figured out what was happening, okay? The patient arrived to the hospital with a swollen foot and severe pain. At glance, this looks like cellulitis or a simple diabetic foot infection, okay? So, they see redness, swelling, cellulitis, okay, yeah, okay. But one test changed everything, okay? Like I said, key diagnostic factor is getting imaging. X-ray or a CT reveals gas bubbles within the tissue. This is a classic red flag of gas gangrene. I mean, it's kind of interesting and kind of cool. Kids love bubbles. And I think it's really cool that it does do that, because it's kind of like, hey, look at me. I need a lot of attention. Okay. Or I guess, you could say that the bacteria is a big farter. I don't know. But it will show on X-ray or CT. It will be a lot of bubbles, okay? You have to look for that radiolucency. That was a big thing. And you podiatry students, always keep that in mind. The radiolucency, please always get x-rays whenever a diabetic comes into the ER for a consultation. Get x-rays of their foot just in case, especially if they have any wound, okay? Because a lot of people have missed gangrene in the past because they did not get x-rays. And they might even have a non-elevated white count. So please get x-rays, okay? And if you're even more suspicious, the CT scan, okay? Then the skin changes, the foot starts turning black within hours, okay? And then the foul smelling discharge. That is, everybody who's experienced the smell of gas gangrene knows the smell of gas gangrene. It's a very strong, pungent smell. You'll never forget it, and you'll always know it, okay? It's like, ooh, yeah, you'll never forget it. So at this point, the doctors didn't want to waste any time. The infection was spreading and they needed to act fast. This pod students is one of the medical emergencies from a podiatric standpoint. So that will be always on your board. So always remember that, okay? That's a little pearl right there. So what is the emergency treatment for gas gangrene? Immediate surgery, okay? So the patient underwent emergency debridement where surgeons removed all the infected tissue to stop the spread, okay? Then they need IV antibiotics, okay? High dose, broad spectrum IV antibiotics. Why is it broad spectrum antibiotics, okay? Because we did not take a culture yet. We don't know the culture and sensitivity of exactly all the different bacteria that are in that wound, okay? And it's very rare for a diabetic wound to be just one bacteria. It's always polymicrobial, not monomicrobial, okay? And then in some cases after surgery, once they're kind of like in the process of recovery and treatment and healing, hyperbaric oxygen therapy actually helps slow bacterial growth and is a treatment option for patients once they get discharged from the hospital, okay? And luckily, this patient received the treatment just in time. But if he had waited another day or two, he could have, faced a much worse option, which is most likely amputation or even death. I have heard stories in the past. Yes, the patient becomes septic and can die, okay? Because it's a very overwhelming infection for your body. Okay, so what can we take away from this case? The biggest lesson is that diabetic foot complications don't always start with a dramatic wound, okay? Sometimes something as small as a red bump can turn into a medical emergency. So, key takeaway for patients. Number one, never ignore unusual foot changes. Even a small bump or swelling could be the start of something serious. That is why I always think diabetics have a valid reason to come into their doctor or even ask questions. Hey, my foot looks a little weird. You should not wait at all. Never. until something big happens, like there's drainage or you start feeling weak. You should always follow up with your podiatrist, even if it's just like a 5-minute follow up check in. That will save a lot of time, effort, and prevent amputation. Okay. So that's why I always try to give my patients, even my phone number, just text me or send a photo of your foot so I can just make sure. Okay. Number two, if you have pain or swelling that gets worse, get medical attention ASAP. Gas gangrene moves fast. Number three, diabetics should inspect their feet daily. A simple habit like this can save your life, okay? So at the end of the day, like we say, the 60-minute rule. At the end of the day, for every diabetic, check your foot. Check your foot either with a mirror, but if you don't have a mirror or you can't bend over, ask a family relative or somebody to check your foot right before you go to bed, okay? 60-minute rule for diabetics. That can save a lot of limbs, okay? So what are the key takeaways for healthcare providers? Okay, so think beyond typical infections. Whenever there's a diabetic, think beyond typical infection. If a diabetic has a rapid swelling, painful foot or without clear injury, please suspect deeper infection. Number two, imaging, early imaging, x-rays, baseline x-rays should always be a must, or a CT scan can reveal gas in the tissue before it becomes more obvious. I definitely have a little story about that. Just quickly, side note, I had a patient maybe two years ago. He got discharged from a hospital. He was in the hospital for a month, got discharged from the hospital. He needed to follow up with a podiatrist, and he had a heel ulcer. And I said, let's get baseline x-rays. When he finally got the x-rays, because we did not have an x-ray in the clinic, he went to get the x-rays. I wanted an MRI as well. So I ordered x-ray and an MRI because he just got discharged like the day before. And when I saw the x-rays, he had gas. I had to call him immediately and say, hey, go to the ER immediately. You have gas. And I remember this patient seeing me last year and telling me, hey, that saved my life, because he did not have any signs of systemic infection at all. He did not have weakness. He was just in a wheelchair because he had some type of cardiovascular procedure that was done. But he was discharged while he had gas gangrene because nobody checked his foot. He said nobody podiatry-wise visited his foot. So, but please, everybody, check your feet. And then number three, act fast. Infections like this progress by the hour, not by the day. Okay? So let's go with like our closing thought. This case is a reminder that diabetes affects more than just the blood sugar. It impacts your healing, infection risk, and circulation. So if you or someone you love has diabetes, daily foot care is a must. So don't wait for symptoms to get worse. Early action can save limbs and lives. So thanks for listening y'all have to forgive me. I'm not the biggest talker, but thanks for listening to Diabetic Foot Files. If you found this episode helpful, share it with someone who could benefit. And don't forget to subscribe for more deep dives into diabetic foot health. Have a topic or any questions, send it in, and I might cover it in a future episode. Until next time, take care of your feet. They take care of you. Bye. Bye.